Hello everyone, it's Melanie. I wanted to come on here and talk more mostly to those that have little kids or help care for infants and toddlers about febrile seizures, also known as fever seizures, and keeping some sort of simple first aid kit or supplies on hand like children's Tylenol, children's Motrin, fever pain reducer, diaper rash ointment, and a digital thermometer in case you need it. Because more so with kids, it's not about if you need it, but when you will need it. Very often we see parents bringing their kids to the hospital for simple cough and cold symptoms, sore throat, runny nose, rashes, bad diaper rashes, and fevers without checking to see if they have a fever or thought about giving them something to help relieve their minor pain or fever if they know that they have one. Some of the responses we get when we ask parents, do they have a fever? I don't know. They didn't feel hot. Okay, well, how long has he been sick? He started complaining of a sore throat about 3 days ago, but he started throwing up yesterday after he ate. Plus, I know something is wrong with my child because he ain't never this quiet. Okay, you said he's in pain. His throat is hurting. Have you given him anything for the pain? Nope, I just brought him here. Plus, I don't have any of that at home. Okay. Parents, I understand when your child is sick, you're concerned, you're worried, and you just want them to feel better as soon as possible. However, for simple common cold symptoms, fevers, flu-like symptoms, and non-life-threatening emergencies, there are a few things you can do prior to bringing them to the hospital that may just help relieve some of their symptoms and discomfort. Like you want to check your child's temperature using a thermometer if you have one to see if they have a fever, because with kids between the ages of 5 months and 6 years of age, they are at a higher risk for a febrile seizure or fever seizure, which is very common in children, but it can be a very scary and terrifying thing to see, especially for a parent that has never experienced a child having a seizure. A fever is a high body temperature in response to an infection somewhere in the body. So a fever itself is not a sickness. It's a sign or symptom that something is going on in the body, usually an infection. A temp greater than 100 is usually considered a fever. Now with febrile seizures, it's the fast spike in temperature is what usually causes the seizure. Meaning, let's just say you take your child's temperature, you check it, and he has a low grade fever of 99 and he don't feel hot at all. Moments later, he started seizing out of nowhere. He has this dazed look. He's not responding to you. He may be shaking. He may even be foaming at the mouth, eyes rolling in the back of his head. And you touch them and you notice they are suddenly burning up hot. They like to think it's the fast rise in temperature that usually triggers these seizures. Simple febrile seizures are usually harmless and doesn't mean that they will have brain damage or have reoccurrent seizures. But if you experience your child having any seizure-like symptoms or seizure-like activity, first thing is not to panic. And I know that may be hard to do, for parents seeing your child go through this. However, you do have to remain calm because you have to make sure that you are able to take care of this child. You have to take care of the child, so react, but don't panic. Lie your child down safely, preferably on their side. Make sure their airway is clear and don't put anything in their mouth. Do not try to restrain them either. These type of seizures usually last less than a minute but can last up to 10 to 15 minutes. And you do want to get that child to the hospital or call EMS to be evaluated. In kids, it's typically something like a ear infection, cold symptoms, a throat infection after getting their immunizations, but it can be any infection that causes febrile seizure. There are some comfort measures and things that you can do that may help prevent a febrile seizure, although they're not always preventable. You can call their doctor and ask them what you should do or what do they advise you to do for your child. If it's appropriate, based on your child's height and weight and age, there are some over-the-counter pain relief, fever reducing medications to help manage their symptoms. Don't overdress them if they have a fever. You can wipe them down with a lukewarm towel, not cold. Keep them comfortable and give them plenty of fluids to help prevent dehydration. Kids are at a higher risk of getting sick, especially during flu season. They pick up germs everywhere from school. They sneeze, they wipe their nose with their hand and end up spreading the germs, on everything that they touch. Plus, their immune system hasn't fully developed to fight off a lot of germs and viruses like ours. So consider having some sort of simple first aid supplies on hand for your babies. And a lot of these items aren't usually expensive. You can actually purchase a thermometer at some dollar stores, and just keep a close eye on your babies, especially when they're sick, and contact their pediatrician as soon as you can. Okay? That's it, guys. You all be blessed. Bye.